second Texas Hand Society member spotlight interview for the month of April 2025. Dr. Brendan Mackay from Lubbock, Texas, has graciously agreed to be our second interviewee, and just bringing you Dr. Mackay live from Lubbock this evening. Dr. Mackay, you want to take it away?
Yes, thanks for having me, John. I appreciate it. I look forward to seeing what the Texas Hand Society is going to do because I think it's going to be a real special opportunity for us. So I'm currently an associate professor of orthopedic surgery at Texas Tech University Health Sciences Center. I'm also the co-director of orthopedic research in the department. I'm the director of hand and microvascular surgery at University Medical Center, which is our level 1 trauma center we're affiliated with. I'm a fellow of the American Academy of Orthopedic Surgery as well as the AOA. And I had the distinct pleasure of being a past president of the Clinical Orthopedic Society, which is one of the oldest orthopedic societies in the United States.
Very cool. And I've gotten to know you over the years since I was a fellow. So it's been great getting to kind of get to know you as I've matured as a hand surgeon and going to a couple of instructional courses and getting to kind of work on some things, learn from you, tips and tricks. So I really appreciate your time with us. So we'll kick it off. Can you give us a little of your background on how your career path took you to where you are today as a hand surgeon in Lubbock, Texas?
So my path has been circuitous, and I think people say, your best laid plans kind of never materialize. So I'm originally an East Coaster and went to college at Notre Dame and went to medical school at Northwestern. I had a desire to go back home for my training or be near my family, so I ended up at NYU Hospital for Joint Diseases, which is now the Langone Medical Center. And when I got done being in New York, I again was kind of itching for a different experience. And I was looking at fellowships outside of the East Coast and was lucky enough to match at the Hand Center of San Antonio with Dr. Green. So had a great year there. And as I was looking again, wanted to kind of spread my wings and experience something different. Didn't really have an inclination to go into academics. I think some of it was the result of being in a fairly high pressure academic training program and thought I was going to be a private practitioner. So I joined a private group in Austin, Texas. I was there about a year and a half. And in that point in time, realized that I was probably going to have a bit of an atypical career based on what I wanted to do. The plan was actually to move back to New York and had already talked to some people who were in serious negotiations for a possible position and met my now wife, who is a Texan. And, Texans don't like to stray too far from Texas. And so anyway, I brought her to New York thinking, well, this may be a thing. We may be together and she might be moving to New York. And she had a great time and said, there's no way I'm moving to New York after that visit. So ultimately, I kind of went. I did locums for a while and started to look around. And I signed a 3-year contract in a level 2-3 trauma center in North Platte, Nebraska, which is on the far western edge of the state on I-80. And I spent 3 years there. And that during that time is when I passed my board exam, and I was really the only hand surgeon in the western half of Nebraska. So it was really interesting. And during that time, I learned a lot. I was hospital employed, still knew something was missing, wasn't exactly realizing what I thought I needed to be doing. Was having that feeling that maybe academics was where I needed to be. It was so surprising. It was a 180. Got a phone call from a gentleman who was a fellow at NYU and in pediatric orthopedics, and who was working at Texas Tech. So it's amazing how the stars align, considering my wife is a Texas Tech graduate. And he called me a number of times, and I kind of politely disregarded those phone calls the first few times. But the third phone call, I believe, is when I said yes. And within under 6 months or so, we were moving to Lubbock, Texas. And from there, the last eight going on 9 years, I've been in the department, and I think I've kind of realized that why I ended up here, because it's provided me and afforded me a lot of opportunities that I just don't think I would have had elsewhere. So it again, it's one of those things where you may have a lot of ideas about your life and your career, but sometimes life just guides you where you need to be.
Yeah, very cool. I've heard you talk about your experiences there working with trainees, and you definitely sound like you've landed in the right place there in Lubbock. Next question, who were some of the key hand surgeons or other mentors who inspired you to go into hand surgery?
So I had an interest in orthopedic surgery from fairly early on. My mom was a nurse and she worked in some orthopedic practices and got some exposure. And I was kind of I played college sports and had that kind of typical orthopedic background. I broke my hand when I was rowing crew at Notre Dame during some training, and I had to go see a hand surgeon my mom worked with, Dr. Ark, who was at Princeton Orthopedics. And really, that was my first direct exposure. I don't think that exactly tipped the scales to going into hand surgery, but ended up by the time I got to medical school, I was exposed to a gentleman named Dr. Brian Hartigan, who unfortunately passed very early at the age of 40, but was a rising star in the ASSH and other hand societies. And when I was a medical student at Northwestern, I just was really intrigued by him and his career. He'd actually been uh, an orthopedic trauma surgeon, trauma fellow before he became a hand surgeon. And I
Oh,
thought that was interesting. And then when I went on to go to NYU for my training, I had several people, Dr. Nady Paxima, who was also a hand surgeon, but did a lot of trauma. And then I also, Dr. Reddig and Dr. Lenzo, very different practices than Dr. Paxima, but really kind of this spectrum of hand surgery. And I think exposure to all those facets really got me interested. But I will give a lot of credit outside of the orthopedic department is that when I was a resident at NYU, it was a lot of influence from the plastic surgeons. We had a plastic surgeon who was doing complicated wound care solely at our orthopedic hospital. And then we had Jamie Lumian and Pierre Sade, who are very well-known plastic surgeons. And they were very supportive. I mean, almost to the point as a PGY2, I thought about leaving to become a plastic surgeon and even got into exploring it. And just after a lot of kind of soul searching and thinking about the realities of changing programs, I realized I could do that through hand surgery. And so I think that's really around my second or third year, it was becoming really clear that that's what I wanted to do. And, all the folks at the hand center obviously had already made the choice, but sometimes you make choices and are not sure they were the right choices. But exposure with Dr. Green and Dr. Bag and Dr. Peterson really reinforced that I had made a decision that fit what I was wanting to do with my career.
when you got to Lubbock, Texas, can you tell us a little bit about the landscape of hand surgery there in Northwest Texas when you first started practicing there?
Well, obviously Lubbock is a college town and it does have outside influence mostly related to the university, but we are geographically isolated. And now, as I said, going on my ninth year, many of the folks who landed here either were tied to the region or had some type of reason, such as a military background or something else that drew them to this area. And there were, I think, about five or so hand surgeons when I got here, but there wasn't a ton of complex upper extremity care being done. Limited peripheral nerve, limited soft tissue coverage, and there's not still is not tremendously a cohesiveness in West Texas because we're separated by a lot of distance because we've got Midland, Odessa. I know some of the folks and the names out there, but just it's hard to have interactions with them, right? Other than kind of being on the phone occasionally. And originally, when I got here, I didn't really know the folks at Texas Tech El Paso. Have come to know them and they've developed some relationships with us, but it was really the two main hospitals locally that were dealing with a lot of it. And most of the hand trauma from north of us in the Amarillo region was being sent this direction. The majority of the folks up there were private practitioners and, taking call, but maybe not as available to take care of some of the complex hand stuff. I will credit my partner, former partner, Dr. Desiree McKee, who was a general surgeon, then a burn fellow, and Dr. Bobby Chopper, his first fellow. And I think out of all the exposure I had, she was one of the folks really trying to push the envelope on more complicated care, right? And so that made it a natural fit for me. And since that time, we've gained and lost hand surgeons, but the net yield has been positive, and I now have two new partners, one of which is a triple fellowship trained hand, sports, and shoulder elbow, and the other gentleman is a general surgery and a hand surgeon. And so we've now at Texas Tech have a real young group of hand surgeons who are eager to do cutting edge type of stuff, which is fantastic. We still have some local guys who do some other things. But I think in general, they defer to sending a lot of it to us, the more complex care, especially reconstructive and trauma care. So I do see it as a positive trend that we've experienced in Lubbock, but we have some challenges just being where we are that contribute to making it difficult to serve everyone as well as we want. Right. The catchment area here is probably one of the largest in the United States, just in terms of geographical area. We serve southern Kansas, Panhandle of Oklahoma, eastern New Mexico. And if you look around Texas, it's 5 to 6 hours to El Paso. It's Amarillo is a couple hours away, but again, no university there. Dallas Fort Worth is another 5 hours. Austin, San Antonio, 5 to 6 hours. So we've got this pretty big geographic circle. I've been told that the estimates in terms of number of people is somewhere between 9 and 11 million people.
Wow.
Which, if that is true, that's essentially one level one trauma center taking care of New York City.
Right.
So that's a very unique thing about us. Obviously, West Texas is expansive, big. It's just different than pretty much anywhere else I've been in the United States, and we see a lot of complex problems because we're dealing with folks driving through here, semi truckers. We have fracking and other oil industry things. We've got cotton ginning, which happens here. We've just got different kinds of industries that are not what the injury patterns are different, right? And a lot of other places are not exposed to these. And again, these patients are maybe getting injured and traveling here from long distances. So that leads into difficulty with sometimes even getting people to be able to follow up. It's not because they don't want to, just resources, driving, being able to get here when you've been injured. Therapy is a huge deal. It took a long time to build a network of folks, both in New Mexico and throughout Texas, that I trust to take care of my patients, because I think we all know that hand surgeons are only as good as your therapist. That's something I was taught, and it's very true. And there is a bit of a burden of complex care. I did very little burn surgery. We have we're a tertiary burn referral area, so I've kind of had to learn that, and I do some sarcoma work and other things that in many other university hospitals would be addressed by folks that had subspecialty training.
Right.
So for me, that's been exciting, but it is, and burden may not be the right word, but it does bring a level of stress. Especially when you desire to provide as high a level of care as I think we want to. Things are just not always perfect. I know they're not perfect anywhere, but a lot of these factors just add difficulty to that, right?
Got it. Got it. So kind of like the Wild West in some ways still.
There is some reality to the Wild
Yeah.
West. Yes.
Yeah. Yeah. It sounds like a great place to practice, especially for young and has some enthusiasm and taking care of some complex things. Let's see, who are some of the people that you have trained so far? And I know you're young, but that you reflect on that you'd like to talk about who have made an impact or started making impacts in the field of hand surgery.
Well, I'd like to say that in my 8 or 9 years, I've had someone every year go into hand surgery, but that's not the case. I think in terms of hand surgery specifically, I've had one resident who decided to go into hand surgery and ended up matching at my fellowship alma mater. So I think that's a proud accomplishment to have someone go there. And not only did he go there, but he did well, and now he's in private practice. So that was Dr. Christian Douthit, one of my residents. So I think that was exciting and created some extension of the lineage through the hand center.
Yeah.
He's still very young, and I don't think he's made all the books yet, but hopefully he'll make some impact as time goes on. So being young, I don't know that I have anyone that is going to be a pillar in the hand society just yet.
Right.
But I think what I'm most proud of is the fact that we've really brought a different perspective to what they thought hand surgery was here. And so I have a lot of residents that feel very capable of taking care of hand problems, even if they're not going to be hand surgeons. And that's not something I made up. That's feedback I get from them. And so while I may not be training fellowship hand surgeons every year, being able to provide people into the community that do good hand surgery, good hand care, or at least recognize what needs to be done and get them to the right people, I think is a huge impact. Um, and I've had a chance to work with really some fantastic residents, and I know that because some of them have gone into more rural practices, that they are doing hand surgery. So uh, a bit of a long-winded answer, especially since I don't have any one particular leader in the field yet, but I hopefully it will come.
That definitely communicates that you're making an impact, though, what you just described there. You've got some folks out there doing some complex things related to hand surgery in some rural areas, and that's pretty cool. Where did that one uh, past resident, where did he wind up practicing?
He's in Texas actually, so he's outside, I believe, on the eastern side of Dallas, and I'm despite
Gotcha.
being here almost a decade, my Texas geography is not perfect, but I know he's a Dallas suburb somewhere.
It's a big state. Every time I talk to you, you've got something new and big going on. Can you talk to us about some of the recent work you've been doing as far as research, innovations, other projects that are kind of in the irons in the fire for you right now?
Yeah, no, I think probably it's some of my undiagnosed ADD or ADHD that keeps me involved in these things, but I really do enjoy having a bunch of irons in the fire. I think some people are built to work. I'm kind of a worker. I come from a family of workers, but so it's nice to have your attention diverted. But honestly, the real reason if you look at NYU, my class, there's some very impressive research people there. They were impressive when they graduated, they're impressive now. And I was a little bit of the redheaded stepchild. I did enough, I looked okay. The excitement about the research for me has been that being in a place like this, I've come up with more questions than answers. And so this is self-driven or driven by the fact that I want to do better, want my patients to do better. And that's, I think, is what become the driving force. So with that being said, some of the stuff I focused on for a long time is large traumatic nerve gaps and how to combine complex reconstructive procedures, including nerve transfers, tendon transfers, and timing for that to try and get outcomes, and maybe how that relates to brain plasticity and how the body reacts to some of these tremendous injuries. And we haven't written the paper just yet, but I'm sure a lot of orthopedic surgeons are understand the idea of early total care. That's something that's been in trauma care and orthopedic care, right? We're kind of applying that to nerve injuries. And for example, if you talk about the ulnar nerve, classically, if you have a bad ulnar nerve injury, you fix it, graft it, maybe transpose it, maybe come back later, do a distal decompression, maybe add a nerve transfer, maybe do some static or dynamic procedures. But we're really trying to look at listing all the things that we think can be done either acutely or in a short subacute period. and how that may improve outcomes in catastrophic proximal mixed and motor nerve injuries. So that's something that I've been doing for a long time, and we still do a lot of projects related to it. The other thing that we've gotten really excited about is something that's been coined NTNI injuries, or non-transected nerve injuries. Everyone focuses on cut nerves, and that's because, it's cut, you got to do something about it. But quite frankly, the disability from nerve injuries that are non-transected is very high. There's a lot of chronic pain associated with it, and a lot of patient dissatisfaction. And so really sinking my teeth with some interesting folks into looking at how we improve outcomes for that, whether that's neurolysis, wrapping, electrical stimulation. I've done a lot of complex limb reconstruction, and I know that's not specifically hand surgery, but a lot of hand surgeons have been involved in this, whether they have a plastics or not background. And it's been pretty fantastic to be able to have that experience here. And I interface with orthopedic traumatologists and plastics folks and burn folks and general surgery folks. And so I keep working on that. And we don't have a dedicated plastic surgery service here. So it's me and my orthopedic trauma partners taking care of mangled limbs. So it's cool to start developing algorithms that are non-microsurgical, or that start very low on the reconstructive ladder, and be able to get some fantastic outcomes. So we have some papers coming out about that. I've done a lot of amputee care, which is another thing that wasn't necessarily on my radar early on, but we've got a lot of amputees that had problems when I got here, and we've been trying to elevate the level of care. We're involved in a DoD study that's looking at nerve capping as an adjunct to TMR and RPNI, and how you may manage transected nerve ends and really mangled limbs when they're not amenable to definitive reconstruction. And then the last thing that I'm really excited about, and it's really not my research, but I'm going to be a part of a group of about 40 surgeons introducing the CMC touch prosthesis from Carry Medical into the United States, which is a dual mobility CMC arthroplasty that essentially looks like a little total hip. And we're going to do some data collection around that. And based on my recent trip to France to see surgery and patients, I think this is going to be a complete game changer for a very common problem. So we have a lot going on, but that's kind of a smattering of what we're doing these days.
Do you have any anecdotes about hand surgery in Texas that you'd like to share?
Well, I was just giving a talk back at my alma mater, NYU. I got invited back for an alumni talk, and the first talk I gave before the hand surgery was on lower limb amputations. And one of the questions I got was kind of, why is a hand surgeon talking about this? Isn't this? So I said, well, suffice to say, hand surgery in West Texas is a little different than hand surgery in New York City. And I think that kind of leads into what my residents have said. Well, hand surgery at Tech, at least, or in West Texas, is defined by anything that the hand touches, more specifically, whatever Dr. Mackay's hands are touching. And I really have kind of taken that approach. I mean, if I can be helpful, I've tackled a lot of things. I've been involved in chest wall reconstruction with the cardiac surgeons, and I've helped the ENT surgeons, and I've done upper and lower extremity nerve care and reconstructive procedures. And as I said, do some oncologic work, and we'll do some pediatric work when I have to. So, again, the beauty of it for someone like me is I have the opportunity, and as long as I can convince myself not to shy away from it, I got lots of things to learn.
Got it. And then last question, can you trace your lineage from Dr. Sterling Bunnell to you and your training in hand surgery?
When I was looking at the questions you were asking, most of them were fairly easy to write this down. And I said, well, this is kind of a challenging one, but you do see these charts a lot where the lineage is traced down, and it is a cool thing. So I did it today, and surprisingly, it's pretty short. So if Dr. Green was the head of my hand fellowship, the founding member, and was still practicing when I was there. Dr. Green was trained by Dr. Carroll, who was at the New York Orthopedic Hospital, which is part of Columbia. And Dr. Carroll was training in a time post World War II when there was no hand fellowships. there were hand surgeons, but fellowship was not what we think about this time. And he was actually the one to develop the first 1 year hand fellowship. But interestingly enough, because there were no fellowships, while he did have some influence from the folks at Harvard where he trained, he traveled around to do a fellowship, right? The idea was, okay, I want to learn hand surgery and I'm going to travel. And so his travels included visiting Dr. Bennell and the folks that Dr. Bennell had trained. So you only have to go from me to Green to Carroll to Bennell.
Got it. Well, I think that wraps up our interview for April 2025. I really appreciate your time, Dr. Mackay, spending that with us. And it's exciting to hear you talk about your experiences and what you're working on now. And we're definitely grateful to have you a part of the Texas Hand Society. And as this matures and you get more involved, it'll be exciting to see what you can help us accomplish in the future.
Well, great. Thanks for having me. And I look forward to seeing all the other members of the Texas Hand Society. I think it's going to do great for increasing the accessibility to hand care, the collegiality amongst the hand surgeons in the state of Texas, and our ability to really provide, a better net for the patients that need to move around the state if they get hurt outside of their hometown. So thanks again, and look forward to seeing everyone at the first inaugural Texas Hand Society meeting, which I believe will be next year, correct?
That's correct. Yes.
Oh, well, great. Well, I appreciate your time. Take care. Have a good night.
You too, Brennan.